Your body is doing all sorts of crazy things. You have no idea what's a sign and what's not a sign. Today, I'm going to give you 4 signs that really show that labor could be near, and I'm going to dispel a few that are not surefire labor signs. So I'm really glad that you guys are here. I've seen thousands of patients go into labor, so I can really tell you what really is a sign or is not a sign. It can be really confusing. I know it seems like you would know when you're going into labor, but it's more confusing than I ever thought it would be, even as someone who was a labor and delivery nurse and had babies. And in case you're like, I don't want to have to remember all these, or you're taking notes, I actually have a whole checklist of labor signs that you guys can grab down below. I'll put the link there. Okay, the first sign that you're gonna have your baby soon is that it is close to your due date. I see so many people who are like 37 weeks and they're like, I think the baby's coming soon. And I'm like, no, substitute for you hope the baby is coming soon. Now that isn't to say that some babies don't come, but the average, this is how we came up with a whole 40 weeks thing. The average amount of time that people is pregnant is 40 weeks from their last menstrual period. And so you're most likely going to go into labor around that date, plus or minus 2 weeks. That's right. Sometimes 38 weeks, and some people go all the way till 42 weeks. Now, that's something that you're going to want to discuss with your provider. But if you really are like thinking, I'm going to have my baby at 37 weeks, let me redirect you to think that it's really going to be closer to your due date. And then you can just have a happy surprise if the baby ends up coming earlier, if you're miserable being pregnant. Which I get it. I see you. I've been that person before, but thinking that you're going to go late usually is a better mindset to be in, so that you're not disappointed that you're heading to 39 weeks and you're like, I've been pregnant for so long, when we knew that this was the most likely outcome. Okay, the second one is that your water breaks, and you're like, duh, Hillary, of course. But even with water breaking, it sounds like it would be so clear. Like the faucet just turns on, water comes out, and then the faucet turns off, water's done coming out, and you know that your water has broken. But depending on where on your uterus your water breaks, sometimes you just get a little trickle now and then, and sometimes you do get that big gush that we all expect to see from the movies. But if your water breaks, it is a sign that labor is going to be soon. Now, it may not be a sign that you need to head right into labor. I have a few posts about if your water has broken and what you should do next. I'll put some of them down below so you can check them out. But sometimes you think, is my water broken, just because discharge changes a lot down there? And that can be a sign that something's starting to happen. Not so much a sign that labor is going to be soon, but it is a sign that things are starting to happen maybe. And because of that change in discharge, it makes knowing if your water is broken a little bit really confusing. And if you're in that point in your life, I get you, I see you, it is confusing. Of course, a lot of pregnancy, labor, birth, postpartum can be confusing. That's why I recommend the online prenatal class for couples. I think it really helps you get prepared and not scared for birth and postpartum and labor and all these different things. So I'm going to put the link for that one down below as well. I want to know what you guys have heard might be some signs of labor. Tell me down in the comments. I think that would be a fun discussion to have. Okay, the next one is losing your mucus plug. Now, this doesn't always mean that labor is going to be soon, but most often I see, if you're due, some people lose their mucus plug early on in pregnancy, and I guess the mucus plug can regenerate. If you have no idea what the mucus plug is, I have a post about it down below, so I'll put that. But if your mucus plug comes out, and yes, it looks exactly like it sounds, that can be a sign. I think that labor will probably come in the next few days to a week or so. And that's just after seeing people for a long period of time. Now, I've had a number of people come in to labor and delivery just because their mucus plug came out and they thought that meant that they were going into labor, and that is not true. Also, please don't bring it in a Tupperware. We also don't need a picture of it on your phone. I believe you if you say your mucus plug came out, but it's not a sign that you are in labor, but it definitely shows that something's happening, your cervix is softening, and maybe you're going to have that baby soon. Are you guys interested in more information on the mucus plug? Tell me down in the comments. I don't know why you would be. It's so gross. I actually gagged on my third baby, which is the only baby that I saw it on, but mucus is not my thing. Finally, bleeding. Now, you have spent your entire pregnancy trying not to bleed, right? You absolutely did not want to see any bleeding, but bleeding can be a sign that things are starting to progress towards birth if you are due. So when we're looking for bleeding at that point, though, a lot of times it's like a dark brown blood. It's usually not bright red. If you're seeing a good amount of bright red bleeding, you need to get into labor and delivery. But if it's like less than a quarter or it's dark brown blood, which a lot of times the mucus plug looks a little bit dark brown as well, that can be a sign that labor is coming soon. And so it's something to watch for. But again, if you have any questions about bleeding, because there is a fine line, definitely call your provider. Most people have somebody on for them 24/7. Some people tell you to call the hospital. Some providers just aren't on at all. Of course, if you have any questions, you can always head right into labor and delivery, as they are open 24/7, all the 365, 366 days a year. Okay, let's talk about a few things that are not sure signs that labor is coming soon. One of them is pelvic pressure. A lot of people are like, oh, the baby's dropped into my pelvis, which, by the way, I have a whole post on if baby has dropped if you guys want to watch that video. But that can last for quite a long period of time. It doesn't really mean that you're going into labor, even though it is wildly annoying and your bladder is waving a white flag. I see you. Annoying, but not a sign of labor always. Another one that can be a sign of labor, but not really a surefire one, because our gastrointestinal system is already kind of wonky during those last few weeks of pregnancy, is nausea or vomiting. So they can be a sign that labor is coming, but they can also be a sign that you ate something funny or your stomach's just like, I want to contract a little bit too. So not always a sure sign, but it can be. So something to keep an eye on, but don't get your hopes up sometimes with that one. Now, another one that I hear a lot is baby is moving less. I'm probably going to go into labor soon. And I am here waving all of the red flags saying baby should not move less as you progress towards your due date. Sometimes the characteristics of their movement change. And I'm not talking day to day, like over time, they might change to where they're a little bit more squirmy, a little less punchy. But the amount of movement should still stay the same. I'm a huge fan of kick counts. If you guys don't know how to do them, you can find my cheat sheet down below. But a quick Cliff Notes version is you're seeing how long it takes your baby to give you 10 movements. You're doing it about the same time of day. If your provider has said anything different than that, grab my cheat sheet down below, because it is the evidence-based way to do kick counts. We're working to transition providers to that method, but it's taking time. So grab my cheat sheet. It's going to be super helpful. I recommend the Count the Kicks app, or if you already have the Baby Center app, they have a kick count thing on there as well. I'm just here to tell you that a lot of this just isn't as clear cut as you always thought it would be watching the movies. And I got to say, pregnancy, labor, birth, so much of that is not going to look like you thought it would. So I would recommend learning from an expert. Again, the online prenatal class for couples is going to be your friend in that one. Okay, I have a whole video of some of the early signs of labor, and I think you guys are going to find that helpful, so I'm going to put it up. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.